Dr. Jaraza for an important discussion about vaccines, especially around the Johnson & Johnson vaccine. Dr. Jaraza, thank you for joining us this evening.
No, thanks so much for having me.
Today, folks, just so that everyone knows, we have had 184,906 people that have received at least one dose of vaccine here in Baltimore. That is 31% of our population. As you may have heard, on Tuesday morning, the federal government issued a guidance temporarily suspending production of the Johnson & Johnson one-shot vaccine out of an abundance of caution. And I want everyone to hear this next statement very clearly. 6 people out of the roughly 6.8 million recipients, that's six out of 6.8 million recipients of the vaccine experienced a rare blood clotting issue after their shots, according to a joint statement by officials from the Food and Drug Administration and the Centers for Disease Control and Prevention. The agencies are now investigating a potential link between the vaccine and the clotting issue. As the statement said, we want to break down with you this evening the myths and rumors surrounding the decision and vaccines in general, and answering your questions as we continue to navigate this pandemic together. Now, I want to reiterate that this federal decision does not have much of an impact on us locally. Most of the vaccines that we're giving out through the health department are the Pfizer and Moderna vaccines. And Dr. Jaraza, again, thank you for joining us. Could you share an overview with our viewers about what we know and what we're hearing from the federal government and the CDC at this time?
Sure. So you touched on the main highlights. Yesterday, we noted the CDC and FDA made a formal announcement pausing use of the Johnson & Johnson vaccine. As Mayor Scott mentioned, 6 individuals, 6 women between the ages of 18 and 48, were noted to have formed rare blood clots in something called cerebral venous sinus thrombosis. This was occurring approximately 6 to 13 days after the vaccine was given. And to date, the U.S. has given over 6.8 million doses of the vaccine. So that means the vast majority of individuals have not experienced the negative side effects from this vaccine and don't need to do anything. But I do want to say that if you have received the Johnson & Johnson COVID-19 vaccine within the past 3 weeks and you develop a severe headache, abdominal pain, leg pain, or shortness of breath, immediately contact your healthcare provider and let them know that you received the Johnson & Johnson vaccine. Again, the risk of developing CVST, or cerebral venous sinus thrombosis, is thought to be low if you received the vaccine a month or more ago. But if you do experience these symptoms, please let your healthcare provider know immediately. For background and information on how this impacts city operations, to date here in Baltimore City, approximately 10,530 residents received the J&J vaccine over the 184,000 individuals who received the vaccine. So that's about 5% of everyone who's gotten the vaccine. The health department only received about 1,400 doses, representing less than 3% of our total amount of vaccine. So again, relatively small amounts. This pause did not impact our operations in any significant way. We continue to have appointments this week. We continue to schedule appointments next week using the Moderna vaccine that we typically use in our mass vaccination pods. And we continue our mobile vaccination response. So again, this was a very rare occurrence, and the CDC and FDA are currently investigating what the cause might be and what the adverse effects might be attributed to.
Thank you for that, Dr. Jaraza. And we know some of our public health officials, and Dr. Jaraza is one of them, are concerned about the way this news could make people more hesitant to get the vaccine, especially if they already had concerns and understanding the history of vaccinations, especially in communities like ours here in Baltimore. I know that there's something I'm concerned about, and that's why we're here today doing this virtual information session. We want you to get your questions in. We'll get to as many of them as possible, and it's very important that we answer those questions. But I also want us to, again, remember the totality of COVID. I saw a meme earlier today that said that we've had 500,000 deaths from COVID-19 and no one bats an eye, but 6 people with blood clots and people pay attention. We have to remember how many people we have lost to this deadly virus. The reality is we need people to get this vaccine if we're going to make it to the other side of the pandemic, because we continue to lose people. Even more than we're now than a year into this, and we're still dealing with this pandemic. We have lost 882 residents of Baltimore City to COVID. Sit with that number for a second. 882. That's 632 last year, and that's 250 already in 2021. That's a severe number, and we have to understand this is why we have to continue to take this seriously, why we're discussing this with you today, and why it's important for us to continue to have our folks get vaccinated. Dr. D, would you tell those out there watching who feel scared about the vaccine, what would you tell them now?
Yeah, I mean, I think that it's important to note that, as Mayor Scott mentioned, this was an extremely rare adverse event. Of the numbers given, this was less than a 1 in a million chance that this happened, and we're still learning. The CDC met today to provide additional information that they'll continue to report out. The Pfizer and Moderna vaccines are extremely effective at preventing COVID-19 disease, preventing hospitalization, and preventing death from COVID. So if you have the opportunity to get the vaccine, please get the Pfizer or Moderna vaccine. Again, those have been proven to be safe and effective, with over 150 million of those doses given across the country.
Yeah, thank you. Thank you, Dr. D. And now, Dr. D, for those who, like me, already, as you gave it to me, they got the Johnson & Johnson shot. And just for everyone to know, I feel healthy and strong and active, was able to visit our rec centers and put up some jump shots yesterday with some of our young people. What guidance is the CDC offering about the effectiveness of the vaccination and any steps that they should take for folks who are a little scared, and understandably so after seeing this happen over the last few days?
Sure. So this does not impact its effectiveness in protecting you against disease as far as we know from the CDC. It is still thought to be a very effective vaccine if you have received it. This is not thought at all to be related to effectiveness. This was an adverse event that was reported in a small number of individuals. Again, most commonly occurring approximately 2 to 3 weeks after receipt of the dose. So if you did get the vaccine a month, 6 weeks ago, it is very unlikely that this would be a side effect for you. So again, if you have the opportunity to get vaccinated with Pfizer or Moderna vaccine, I would highly recommend that you get vaccinated.
And thank you. And Dr. D, just a follow-up on that. Understanding that we know that J&J vaccine still works, and that folks are still going to be able to not contract COVID at the higher rates just like the other vaccines. But also, I think it's important to understand the historical distrust in our medical system, especially for our black communities, and this pandemic is serious. What other rumors and myths are you hearing about the COVID-19 vaccines in general, and what do public health experts like yourself say about those myths?
Sure. So I think you raise an excellent point, right? We know that historically there have been reasons for medical mistrust. One of the things that we've aimed to do throughout the pandemic is be very transparent about the information that we have. So it's extremely important that you go to trusted sources for information so that you're not hearing the myths of the vaccine. Whether or not, a microchip is being implanted. I've heard that one as a concern. That is not true. Right? Again, what we know is that vaccines are highly effective at preventing severe death, hospitalization, and severe disease from COVID-19. But go to your trusted sources. If you have a medical provider, go to your medical provider and ask those questions so that you can make an informed decision about getting the vaccine.
And thank you, Dr. D. And we're going to now jump into the most important portion. We're going to take some questions. First question, Dr. D, for you is, does the data show that individuals who receive the J&J vaccine may be required to, at some point, get another vaccine, either the Pfizer or Moderna?
That's a good question. And I'm going to probably broaden that a little bit because we get that question a lot, right? So we're doing the 2 doses of Pfizer and Moderna and the 1 dose of J&J. Is a booster going to be required is what I think that person is asking. And I think at this point, we're still studying to understand how long does our immune response last after we get the vaccine. So I don't know that we know that yet, but hopefully we'll know it in the next few months. As more people get vaccinated, as they study the people who were in the original clinical trials, then I think we'll have a better understanding of how long the vaccine lasts and how well the vaccine fares against the variants that we're seeing.
And Doctor, I think that, just in a follow-up, I think that the person is asking, like, if they've received the J&J shot already, because of the issues, would they have to get another shot?
No, again, this is not thought to hinder the vaccine, the J&J vaccine effectiveness. The vaccine is still very much thought to be effective. This was just adverse events noted in a very small group of individuals who received the vaccine, but has nothing to do with its overall ability to protect you from COVID-19.
Doctor, the next question is, what about people that have already contracted COVID-19? Should they get the vaccine?
Those individuals should absolutely get the vaccine. We know that our body does have some natural, what we call natural immunity, if we've had a disease, but we think that after a vaccine, we develop even stronger and potentially longer immunity. So we highly recommend still getting the vaccine, even if you've had the disease.
And we know that this is something you and I talk about a lot. What is the population by number, statistics, of the people that are not getting the vaccine? And what else can be done by folks like you and I, but others who are holding out? This call, and we're thankful to this person, says, my entire family has received both shots, ages between 90 and 21, which we're thankful for. But how can we convince others, and who are the folks represented in those not getting the vaccine?
Yeah, that's a great question. So right now, about 30%, as you mentioned, of city residents have received the vaccine. And we know that there still continues to be a large interest, and we're working with partners to ensure that folks have access to the vaccine. So what I'll first say is, at this point in Maryland, everyone over the age of 16 is eligible to receive the vaccine and should pre-register. We have a website, covax.baltimorecity.gov, where you can pre-register, and either we'll call you to get you an appointment or a partner will call you. But to your point, we know that there's still vaccine deliberation that's occurring. So again, our job, we see as the health department, is to make sure that people have information. So we're working with vaccine ambassadors who are going to be within the community to provide that education and outreach. We're working with our faith leaders. We're doing cross-city listening sessions to make sure that we're answering the questions and we're addressing the concerns that people have about the vaccine. I'm a pediatrician by training. I'm always going to encourage you to talk to your primary care provider if you have one about any questions or concerns you have about the vaccine.
Thank you, Doctor. And they have a great question from someone, said that they took the J&J vaccine last Friday and did not have any symptoms. Does that mean that it's not working? Should that person be concerned?
That's such a good question. Everyone is different, right? So we know that with most of the vaccines, some people reported soreness in their arm. I know I got the Moderna. I had soreness. I had headache. But then I know others who had, joint pain and were achy and were fatigued. So everyone is different. It doesn't necessarily mean that your body's not responding. Everyone responds a little bit differently, and that's okay.
And then there's a question that just came in that talks about, will the vaccine be like a demand for future reference, like traveling and flying? I know that that's the conversation that we've heard. Do you want to address it? I'll address that one too.
Yeah, absolutely. I think that, again, that may be a thing where you have to have your vaccination card to travel, similar to how we've encouraged people to get tested when they travel and move about. I don't know that it's not necessarily a national policy yet, but I know it's certainly being considered, and that makes sense. If you think about, sometimes when you travel to other countries kind of pre-COVID, there were certain vaccines or shots that were recommended or required before you went there. So we could certainly see the country, move in that direction.
And this is actually another great question. How do we convince those who have been given information by their primary care provider not to get tested because they've already tested positive for COVID? And what are those cases that shouldn't get vaccinated, people that shouldn't get vaccinated?
So the individuals who should not get vaccinated are anyone who has a severe allergic reaction to any of the components of the vaccine. So all of that information is available online at cdc.gov. I know that when at our vaccination sites, we go through a checklist, and there should be some type of medical pre-screening form to understand what, if any, risk factors you might have that would prevent you from getting the vaccine. So again, at your site, at your visit, or sometimes even before, you should be filling out that pre-registration form to identify anything that might prevent you from getting the vaccine. But again, typically it's an adverse reaction or an allergic reaction to a component of the vaccine.
And then the last question, I think, is something you can hear from people. I think you can put them at ease. They want to know, is there a federal database of who has had the vaccine so they don't have to carry their card around?
Yeah, so the CDC is keeping track of that information. We also have a local database, so that's how we keep track, and we're able to present the information we have on our dashboards. So that is being tracked. I believe, again, the state captures that data, and then it's given back to the CDC.
All right, let's see if there's, Dr. D, while we'll see if there are any other questions, are there any additional things that you want our viewers and listeners to consider, think about the vaccine and where we are, where we need to be, and messages that you think needs to get out to the community?
Yeah, so I mean, I am excited that we're at 30%, again, of all residents here having had at least one dose. When you drill down and look at the numbers, over 55% of residents over the age of 60 have had at least one dose, which also is very reassuring. But we know that means that there's 70% of other people that haven't had the vaccine yet. And if we take children out, maybe that number it's less. So I would encourage all residents, because everyone is now eligible over the age of 16. You're eligible to get the vaccine. Please pre-register on our website, covax.baltimorecity.gov. Please go to our website if you have questions. We've posted an FAQs document around the Johnson & Johnson vaccine, but also have helpful information about the other vaccines and how we've aimed to roll out the vaccination process in an equitable way. So that's a great source of information, again, as is your primary care provider.
All right, this is a great question. It's something that I know you and I love to talk about. And it says, for those who are weary in getting a vaccine and cannot get to vaccine sites, will we be providing more mobile units in communities?
Absolutely. So we started our mobile vaccination efforts with older adults because we know that they're high risk. So we began in senior housing sites, but we'll be wrapping up senior housing sites in the next few weeks. And then we'll plan to do more expansive mobile clinics, mobile vaccination clinics at other locations throughout the community, just like we did our mobile testing. We know that this is a resource that we want to bring to the community, and we'll be doing that in weeks to come.
And then this is a great question about what are options for folks, and are there options for folks who are allergic to some of the ingredients like glycol and prothylene? What options are out there for them?
Yeah, so if you know that you have an allergy to those ingredients, I would actually talk with an allergist, right? Because we know that it depends on the severity, perhaps, of that particular allergy. So talk with your primary care provider, talk with an allergist to understand your risk factors and whether or not you should be considered and go through the process of being acclimated enough so that you can get the vaccine.
The next one is, when is the mask mandate ending? I'll answer that one and say no time soon. The mask mandate will end when it is safe to do so, and that we are nowhere near that portion. There is another question here, Dr. D, about should people continue to get tested for COVID-19?
Absolutely. If you are having symptoms that are suggestive of COVID-19, cough, fever, shortness of breath, nausea, vomiting, loss of taste or smell, you should be tested. If you have been around anyone who has those symptoms or is positive for COVID-19, you should be tested. What we know now is that individuals are far more mobile than they were a few weeks and months ago. We are reaching almost pre-pandemic mobility levels, meaning people are out and about. Though we have a good portion of the population that's vaccinated, we still have what is called widespread community transmission. So going out and being about, especially if you're going in groups, large groups or gatherings, or you're removing your mask around others, is still a high-risk activity. So please get tested.
Thank you. Dr. D, before I close us out, seeing that there are no further questions, do you have anything else that you would like to add?
I would just urge people, please get vaccinated. I understand that this is scary, that the pause can give concern. Please continue to follow our website, that we will keep updated around information as it comes from the federal government. But please, get vaccinated with the Pfizer or Moderna vaccines, which we know are safe and effective at preventing COVID-19 illness, death, and hospitalizations.
Actually, I see a couple of things I want you to address. One is, could you tell when you think that we'll be able to see more children get vaccinated? Two, I want you to talk about, give the folks information for our vaccine sign-up site, that information too.
Yep. So individuals over 16 can pre-register at covax.baltimorecity.gov. It also has a line, I do want to point out, it asks if you're homebound. So again, that's a question we get a lot too. We do have plans for our homebound population to provide support in the home. So again, our mobile units that are going to people who are homebound and can't leave their home. covax.baltimorecity.gov. With regards to children, we know that there are many clinical trials taking place in children right now. I think optimistically, it would be great if children were able to get vaccinated sometime by fall. So that we can, have children return to school and be vaccinated. But I think we'll have to continue to follow the clinical trials and see how they go.
Yep. Thank you, Dr. D, and thank you for your time. I just want to take this time out to say thank you all for watching and about this important information, especially after the unfortunate incidents with the Johnson & Johnson vaccine. I want to remind everybody, we know it's getting warmer, but this is not over. Remember, we've lost 882 people to COVID, over 200 this year alone. We have to continue to wear your mask. As someone asked that question earlier, we need to make sure that we're still distancing ourselves and following CDC guidelines, always listening to the guidance of our wonderful health commissioner. But we also need to talk to our friends, our family about getting vaccinated. We have to break down these myths, these barriers, these walls, this hesitancy, so that we can get back to being the Baltimore that we all know we want to be, and all of us being together. That means having frank and honest conversations with people around us, with people that we know, our friends. For me, having conversations with people who said they don't want to get the vaccine, and men that I know, and having real conversations with them and saying, listen, you take a certain little blue pill from Pfizer, you can get the vaccine from Pfizer as well. We need to be honest with ourselves and get our community vaccinated so that we can finally beat this virus. So thank you all for joining us today, and we'll continue to be with you and bring you updates throughout the pandemic as we had. Stay safe, Baltimore.